cannabis in California with a company called Hello MD, and I saw that the way it helps lives, the way that patients are able to get off of medications, which really should be, all as physicians, that should be our goal, is to get patients down off of the medications. Unfortunately, over the years with Big Pharma, it's been just the opposite. We've been giving patients more pills, more medications, and when they come into the hospital, you're not sure if you are treating the side effects of those medications or the actual condition that they were taking the medications for.
CBD doesn't touch the CB2 or the CB1 receptors. CBD stimulates the body to create its own cannabinoids. That's how you wind up with false positives. So even if you take a THC-free product, you still could test a false positive. So, for example, my son is an airline pilot. He desperately wants, because airline pilots don't get anything. The only medication they can do is alcohol, right? And it's true. So which is terrible. And so I may...
for inviting me here today and the other speakers as well as our sponsors. We're going to be talking about dosing as it relates to the different diagnoses. And my perspective is, as an anesthesiologist, I did some of my training in North Carolina at University of North Carolina and Duke University. I was blessed to actually be placed in Vermont for my pain fellowship, where medical cannabis has been available since 2004 for patients. They have a whole flower concept there where patients can actually
a fear of the loss of autonomy, the loss of mental abilities, the loss of functional abilities, fear related to the loss of dignity, of leaving their loved ones behind to carry on without them, and the fear of death itself. An Italian researcher by the name of Vincenzo Di Marzo tells us that cannabinoids serve 5 essential functions. They help us eat, sleep, relax, protect, and forget, all of which are essential to increasing the quality of life of patients. The researchers at Tikkun Olam wanted to study the effectiveness of cannabis therapeutics, so they conducted a research study. They had 2,041 participants in their study, and what they found was the number of patients taking no medications other than cannabis rose from 428 to 1,095. That means that 667 nursing home residents were able to come off of all of their other medications, some taking combinations of 7, 8, and 9 drugs after a cannabis protocol was initiated. 1,950 patients reported cannabis helped their condition. 1,399 reported it helped them tremendously. 95.5% reported cannabis helped them cope with their condition better, and only less than 3% of patients complained of any side effects at all. So the message I carried forward with me was, if this could be used for symptom control, shouldn't this? The first picture is a picture of my dad, 21 days before he died on Christmas Eve, receiving his albuterol nebulizer treatment. Now you can see that the medication is dispensed through the mouthpiece, but in this picture you can see that some of the albuterol vapor escapes into the air. So what that means to me is that anyone who is administering the medication to the patient, in this case my teenage son, is also going to be subject to all of those side effects that we just saw on that Mayo Clinic slide.
Talk to a patient on an SSRI, they will tell you that being on Zoloft and being on Paxil is like being a zombie. They can't cry, they can't laugh, they can't. Your range of emotions is truncated down to a really narrow a range, and people don't like walking around like that.
Longer than what's been shown for nabiximols. This is a synthetic isolated analog of THC. But in a natural product, one set is about 20 minutes sublingual, lasts about 6 hours. Okay, this is a part I was mentioning about the drug-drug interactions. So here we see THC is metabolized by 2C9 and 3,4. 3,4 is also the enzyme that metabolizes fentanyl and methadone. So when the patient starts on THC, you're going to get some inhibition of the 3,4. So if there's less breakdown of the patient's fentanyl and or methadone or any medication that's metabolized by 3,4, they should have less need for that medication.